everyone. Welcome to Vitals of Academia with NYMC's BINGAP chapter. I'm Jenny Yang, an M2 and a member of the BINGAP e-board. Building the Next Generation of Academic Physicians, also known as BINGAP, is a national organization that aims to help underrepresented groups become aware of academic medicine as a career option and to provide them with the resources to further explore and embark on an academic medicine career. The New York Medical College chapter of BINGAP started in 2022, and it aims to increase diversity in academic medicine and provide students with the tools to begin their careers. Vitals of Academia is a new podcast that aims to highlight the careers of academic medicine physicians and demystify the process of how they built their careers. Today, we have Dr. Fawaz Al-Mufti with us. Dr. Al-Mufti is the Associate Dean for Research and Innovation at NYMC, and he is one of the country's few triple-trained board-certified neurologists, neuro-intensivists, and neuroendovascular surgeons. He joined WMC in 2018 from Rutgers University Robert Wood Johnson University Hospital, where he was the Director of Endovascular Surgery in Neurology. With an exceptional track record of over 250 peer-reviewed publications, he oversees research at WMC's Brain and Spine Institute and is the inaugural director for the Center of Neurological Research and Innovation. As the director of the CNS Neuroendovascular Surgery Fellowship, Dr. Al-Mufti has mentored over 100 students, residents, and fellows. His contributions extend to representing NYMC and the WMC Brain and Spine Institute at national and international cerebrovascular conferences, as well as designing and leading numerous national and international clinical trials. Serving as the principal investigator for multiple major funded multiple site trials, he plays a crucial role in scientific and educational committees of prestigious organizations such as the American Academy of Neurology, Society of Vascular and Interventional Neurology, and the Neurocritical Care Society. His dedication is evident in his belief in a collaborative multidisciplinary approach to patient care, emphasizing patient education and joint decision-making with patients and their families. So let's go right into the questions. Can you tell us about your journey to becoming a physician and what inspired you to pursue medicine?
Um, Thank you very much, Jenny, for the generous introduction. I'm very happy to be here. Um, so, quite honestly, I come from my journey to medicine was probably not a very not a conventional one. I don't think there's a single physician in my entire family. So I'm the first doctor in a long chain of engineers. Um, and Yeah, so I think a good way to start my career trajectory into medicine is to uh, uh, talk you through a flashback that like as you're asking that question, I'm getting flashbacks of like where my career started. I mean, I grew up I was born in Iraq. I grew up in Europe, in the United Kingdom and in Cyprus, and ultimately I uh, after a long period abroad, I ended up moving back to my home country, Iraq, just before the war. Just after some of the wars, well, there were a lot of wars there, but ultimately ended up going into medical school in Iraq. I come from a middle class family, focused on education. So I think it was like inevitable that I'm going to like achieve like do something in academia. I come from a series of academicians. Um, and Yeah, I graduated from medical school back in 2002, so a year before the I don't know, like what is it, like the fourth or fifth Gulf War. But basically after the war in Iraq and uh, just before the war in Iraq, and ended up practicing in one of the largest hospitals in the Middle East at the time. Uh, by no choice of mine, ended up training in emergency medicine because that's what the country needed. They did not need a neurologist at the time. Like this was in the peak of the war. Um, and Yeah, so after that, after training in emergency medicine, like practicing in the emergency room for a couple of years, I ended up joining Doctors Without Borders, and I traveled to several countries, um, uh, several war zones, and by 2008, seen it all, done everything I could potentially do, like in that leg of my career, and I'd met my wife, and we decided that we're going to move to the United States. When I got here, it was a bit challenging because I had to redo my training. So I had to redo take my USMLEs and redo my residency. And I figured life's too short to do the same thing over and over again. And might as well learn something new. I didn't know much about the brain, so I was like, I'm going to learn about the brain. Uh, I had a lot of colleagues like urge me to go back into emergency medicine, and at that point, I honestly didn't think it was. I don't think I was burned out, but I just definitely did not think uh, I was going to do like 10 or 20 more years of emergency medicine. After surviving like multiple war zones, it just doesn't it just didn't make sense for me. So neurology was a nice laid back specialty. Yeah, at least so I thought. I didn't realize that I'd caught the acute care medicine bug, and I really gravitated towards neurocritical care, which was like the perfect marriage between emergency medicine and neurology. So ended up training in neurocritical care. And after that, to add a procedural aspect to my practice, I ended up doing a 2-year fellowship in neuroendovascular surgery. And yeah, that's a summary of like how I ended up in medicine and like a career in like what I currently do.
What made you decide to work in academic medicine, and when did you start doing that? Like after your residency, and what inspired you to add that as part of your career?
Yeah, I think it's a good question. I didn't really think of it this way. To me, I've always enjoyed teaching medical students and training like teaching my junior residents, and like teaching in general was always a passion of mine. But when I think of academia, I always think of like a research, right? A researcher. And I mean, I think as a resident, I probably had published one paper. Like my entire residency, I had like one, maybe two papers. Uh, I think it was like during my neurocritical care fellowship uh, that I basically caught the research bug, and I fell madly in love with research. I remember asking a question, and I said, "All right, well, why are we managing this patient in this particular way?" They were like, "Oh, that's just how we've always done it." So I went back and I looked at the literature, and I'm like, "There's absolutely nothing published on this." So I decided, well, okay, if there's no data, we'll have to essentially study the situation, study the disease process, and come up with data and publish it. So up until now, my like all my trainees will tell you, like Dr. Mufti's research is always based off of his clinical practice. So problem I see like a gap in the literature, a gap in the, and I try to answer that. I think it's that curiosity that allowed me to gravitate towards academia, teaching and figuring out and when you don't have the answers, like I don't want to teach out of the blues. Like I decided that or just make stuff up. So I was like, let's just study this and publish it. And that way, then we can at least cite this paper or that paper. Um, Definitely the fact that we've been living over the past at least 15, 20 years, 2 decades in like the era of evidence-based medicine and more precision medicine. I think it's just extremely important to say that to, to to make sure that you have the data in your field. And if the data is not there, then you have to essentially seek it, find it, publish it.
Thank you very much for the answer. What advice would you give to medical students now who want to pursue a path and a career in academic medicine?
Yeah. I mean, I would say try to get involved in research as early as possible. Not because you want to go into academic medicine. That, academic medicine is not for everyone. Some people may enjoy it, some people may not. I would say if you get involved in research, I think that's going to be beneficial to you, whether you're in academia or outside of academia. But it's a very good, let's think of it as a gateway trait to getting into academia, if you choose to do so. Um, if you end up going into academia, that's great because then you've already started doing some research and you know how to conduct research methodology. You understand research methodology. You understand like how to write a manuscript, how to submit an abstract, how to present. Like public speaking is also an integral part of what we do. But even if you decide ultimately you gauge your research and you ultimately decide you're not interested in um, a career where you're not necessarily going to become the triple threat physician, scientist, educator, that's still okay because you learned research, you learned how to read a manuscript, and that's going to make you a better physician. It's going to allow you to uh, uh, understand like the research that you're reading, okay, or the paper that you're reading, and extrapolate that information to your patients, and the care that you're offering your patients, and that makes you a better doctor. So my advice to all medical students is to try to get involved in research as early as possible. And quite honestly, whether it's relevant to your area of interest or not, I don't think it matters. Ultimately, uh, I mean, obviously, ideally, it should be relevant to the research that you're doing, but I would say so. We run a summer research program where an important part of what we do is essentially teaching students about research methodology. That is agnostic to the specialty you're going into. You need to know how a paper is written. You need to understand how to interpret the results of a paper, and that's what we teach you. It doesn't matter if you're going into orthopedics, pediatrics, OBGYN, plastic surgery, or neurology or neurosurgery. It doesn't matter. Like the research, like interpreting a paper is the same regardless of what specialty you're going into. So my advice to all medical students is try to get involved in research as early as possible. And although you may get like certain lectures and talks during medical school, I'm sure you do. There's nothing like actually starting a research project, forcing yourself to read the research and read the papers and coming up with your own methodology, identify the gaps in the literature, where the limitations of your research are, especially as you apply it to your clinical practice.
Yeah, absolutely. I actually did the summer research program with you guys over the summer. So for any M1s who might be watching, I highly encourage you to apply if it interests you because it was a great program, and I completely agree that just understanding how research works, whether you actually are deeply involved in it in future career is so important for just your patients and your own knowledge and everything like that. What do you think are some of the skills and attitudes that have helped you succeed in academic medicine and might make someone more, I guess, ad adapted for academic medicine?
I think curiosity, just being curious. Just because, like I said, just because the data is not there, just because nobody's published the paper, uh, don't accept that. Like, stay curious, uh, uh, remain inquisitive, and if the data's not there, roll up your sleeves, like I'm rolling up my sleeves right now, and try to answer the question yourself. The individuals who actually sought to answer these questions are not necessarily in any way smarter than you, more dedicated or motivated than you. Quite the contrary, you may be the most you may be the right person to answer that question. If you're asking that question, don't expect someone else to answer it for you. Just take matters into your own hands. Go back, dig into the literature. Very simple way to start doing some of this research is just go back and write a meta-analysis. Do a systematic review. In fact, when students reach out to me, one of the first things with an interest in a particular project, the first thing I ask them to do is to go back, take a week, and write a 1,000 word essay on the disease process. And it's usually a very specific question, like it's a targeted question. It almost forces my students to uh, go back, go to the library, do some research, identify, read at least 5 or 6 papers, distill that information, and come up with 1,000 words that summarizes. Just let's think of like blood transfusion in patients with ischemic strokes. Um, why are we transfusing blood at this or that threshold? That's one. Two, one, like what is happening in patients with ischemic stroke? That's two. Three, when are you transfusing a patient with stroke? And are those goals appropriate for that or not? So they're going to have to go back. They're going to look at what is like they're going to talk about, they're going to research blood transfusion in general. What's the science behind blood transfusion? Why do we transfuse to like a cutoff of 7 grams per deciliter? They're going to look at stroke and all the everything related to that, and then they'll have to find papers relevant to stroke and blood transfusion and impact on outcome. And they'll find like 1 or 2, maybe 3 papers. They'll distill that information. They'll give it to me. And as I read through this, um, it's usually very encouraging to me and to the student for them to know that, like, as soon as I read through this, I review it. I say, congratulations, you just read the introduction of your paper, because that's it. That's the first step. And sometimes the hardest part about writing a manuscript is taking that first step. Now, it's not going to be 1,000 words. We're going to distill this significantly, and what we don't use from there, we'll probably use somewhere else in the discussion. But uh, overall, I think that's at least my approach with many of my students, the students that I mentor, as far as like how to get them involved in research. And my advice to them is essentially remain curious and ask these questions, and don't wait for someone else to answer the questions for you.
That's awesome advice. Always take action, like have a go-getter attitude kind of thing.
Yeah.
Um, so obviously neurology and neurosurgery is like absolutely bustling with research right now. How do you think that it will evolve over the next decade?
Um, so that's a topic that's near and dear to my heart. Like innovation is something I'm very passionate about. I think um, next 5 years. So if anybody would have asked us 10 years ago whether it would have been like imaginable that we would be doing 50% of the procedures we're doing today, I would have said that's virtually impossible, like 10 years ago. I think 10 years from now, we're at the beginning of an era of, in my opinion, an unprecedented. It's a great time to be alive. We're going to be seeing a massive boom in brain-computer interface. I think that's one area I'm very excited about. Um, and this is no longer science fiction. This is happening. It exists. It's been implanted in patients. And I'm not only talking about Elon Musk's Brainlink. I'm talking about like there are at this point easily 5 or 6 companies working on this. Elon Musk's company just happens to be one of the most popular because he's a popular person or like very well-known individual. But overall, there are a lot of updates, and a lot of research being done in that field. I think the future is incredible. I always tell my trainees, my residents, and my fellows, I say, they may look back at us 20 years from now and they may laugh and they're like, look at, they used to, like those barbarians used to go through the groin and open up the blood vessels in the brain. Maybe we'll continue to do this, but there's a very good chance that we identify a medication that you're able to essentially that has is able to dissolve the clot in and of itself that activates once it comes in contact with the clot. 20 years ago, Jenny, multiple sclerosis was a uniformly disabling disease. We had two very old medications that we basically borrowed that were not specific to multiple sclerosis. Today we have 20. Multiple sclerosis today is a chronic disorder, just like diabetes, just like hypertension. So we've made incredible headway over the past 1 to 2 decades, and I think the next decade is going to carry incredible things for the field.
Yeah, I think it's a really exciting time to be in medicine and being able to see all this innovation happening in real time. Part of that, though, is that, doctors, almost all doctors are very, very busy people. What advice do you have for students with maintaining work-life balance and preventing burnout and long-term resilience?
Um, well, that's a tricky question. You ask me, I think my work-life balance is perfect. If you ask my wife, she completely disagrees with that. She thinks I work way too hard. Um, uh, I would say, as long as like to avoid burnout, I strongly encourage everyone to do something that they love doing. If you love doing what you do, um, I don't think it's I think ultimately you minimize the likelihood of burnout. And seeking a place to work in, so I'm very fortunate to work at New York Medical College and Westchester Medical Center because they're very appreciative of the work that I do. Um, I think that they see the value, and I feel appreciated here. Um, I currently do. I'll tell you my schedule. I do 7 days of neurocritical care a month. I do 10 days of endovascular call. Both of these are 24-hour calls. Um, I overlap one weekend, so ultimately I'm working roughly 14 days of call. And it may sound like a lot, but when I'm off, I'm totally off. I don't have to do, I have no clinical obligations. I have a lot of administrative obligations, but those are obligations I brought on to myself because I'm passionate about this. I enjoy doing the research. I enjoy serving in my role as a dean for research and innovation. I enjoy directing the Center for Research and Innovation. I enjoy publishing these papers. If I don't publish another paper till the day I die, I'm fine. I do it for my students. I do it because I feel like they need this, and it's not about me. Uh, a friend of mine once told me, he was like, Fawaz, it upset me initially, but then it made me reflect on this. And they said, Fawaz, you work you live to work. We like to work to live. And I'm like, that's perfectly fine. I think like initially I took offense to it, but then I thought about it. I'm like, it's not wrong. I do work to live. I do live to work. I enjoy what I do, and that's why I'm not burned out. I think I work hard enough. I think some people think I work way too hard, but overall, I'm very passionate about what I do. I feel like when one of my research fellows or medical students or residents or clinical fellows write a paper or learn how to do a procedure or uh, 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 like ask a new question that I haven't actually thought of, which tells me that they've taken this. It's almost like a coach and your team scored a touchdown. So I'm always cheering them on, and it may gets me so excited. It tells me that like I'm achieving something. Um, I don't know if that answers your question, but like I think that summarizes it in my mind. Summarizes how I feel about that.
Yeah, I think that as medical students, we all hope to find something that we are so passionate about that we are just happy to be working on it. And it's obvious that you love what you do, which is super awesome to see and very inspiring because it tells us that there are ways to find something that we love to do and build our career around that. Um, is there anything like skills or mindsets or advice that you developed later in your career that you wish you had earlier on?
I mean, I think um, I think personally, if like a skill that I wish I had earlier on was coding. If I could code as a medical student, I think my career trajectory would have been very different. That being said, I'm happy with what I've done. I'm happy with what I've achieved. But I definitely think if you want to take on a hobby, learn how to code and learn how to run your own stats. Um, I felt like at some point, much later in my career, I felt like I was so reliant on statisticians. At some point, I just got, and I work with like a high volume, high quality research that uh, like I feel like I have to go back to I was just like overly reliant on my statisticians. So at some point I said, you know what, I'm sick and tired of this. I'm just going to learn how to run my own stats. So I went on YouTube and I taught myself how to run some basic stats. So we all study stats, right? We all study statistics in medical school, your USMLEs, but something else like putting that in clinical practice and practice is very different. So I taught myself how to do stats, and that's um, now I at the very least I understand statistics very well, but I can also run basic stats myself. Um, and that allowed me to essentially liberate myself. I think that's definitely something where I would ask all medical students if there was one thing I would have done early, it would have been just the practical applications of the statistics that you learn in medical school apply to your clinical practice. And I think that's going to take you, it's going to elevate your game and going to help you significantly.
That's an awesome answer. I hadn't even thought about, but stats are so crucial to like all research that it's absolutely a very essential skill. Um, what do you think is the greatest barriers for trainees who are wanting to pursue careers in academic medicine?
Um, I think there's this stigma associated with our like the perception of the what I refer to as the triple threat, physician, scientist, educator. People think of research and scientists and think of this crazy-haired a person in a white coat running around, scatterbrain. Um, it's very different. It's nothing like that. I think there is a stigma associated with this. Um, and it's either like I don't think media, TV, and movies have done us have helped the cause in any way. Quite the contrary. I think people see that and are automatically they either gravitate away from it and they're like, oh, I don't want to be that, or even people who don't see scientists as these like goofy, absent-minded, eccentric individuals. Some people see them and are intimidated by this, and they're like, "Oh my God, that's too smart. They're too smart. It's just too much. I'm not that." Uh, I would say I completely disagree with this. I think we're all scientists. I think every physician could become a physician scientist. Anytime you're asking a question and trying to answer that question, uh, that you are essentially acting as a scientist. You're interpreting the science and coming up with your own opinion. I think the big like that in my opinion is probably the biggest one of the biggest barriers because we're all taught statistics. I don't think we take it to the next level as far as like applying the statistics. We're all taught medicine, but there's so much medicine we still don't know. We're not taught how to ask that question about like why is this the way it is? What like answer questions. Check like I think we're just taught to essentially follow the lecture you're given. But there's so much information that's not in the lecture you're given that I still think are important for you to like seek external validation and try to ask yourself like, well, why did this was not covered in this talk? What about the patients who are just as an example, I'll give you. I always talk about the unintended consequences of randomized controlled trials. I love randomized controlled trials. I've run them. I've participated in different stages of them. But I think there's something to be said about uh, expecting the results to apply to every single patient you're going to care for. Uh, Sometimes the trials are designed to be positive. So when I don't design a trial, I don't design a clinical trial saying, "Oh, I really hope this trial is negative." I want it to be positive. I want to show an impact, whether it's a signal. I want to show a signal. But sometimes you look at the signal and you're like, you look at the results and you're like, okay, but does this trial really? Can I extrapolate the results that looked primarily on patients from like 18 to 60 years of age who did not have cancer, who did not have, who were not pregnant, who were not, did not have dementia. Like so many comorbidities are excluded from these trials. So ultimately, you're left with a randomized controlled trial that is applicable to a very small group of your patients you're actually going to care for. Your patients, unfortunately, don't read those same papers, and they have other comorbidities that I think are very important for us to ask questions on, like how do these apply to these sicker patients. Um, so that's essentially how like that's usually what inspires me to come up with new ideas for new papers. Uh, I was giving grand rounds recently, and somebody asked, like, how do you get these ideas? I was like, I get these ideas from randomized controlled trials. They're like, what do you mean? I'm like, I go to their exclusion criteria, and I look at every single one of those exclusion criteria, and I'm like, those are patients who were excluded from the trial. I want to study those. So that's how I do it.
Yeah, that's an awesome idea. That's great advice for all of us medical students. So, I love this last question that I'm about to ask you because we'll wrap up pretty soon. What do you hope to leave as your legacy in academic medicine, both for your students and for your specialty?
Uh, Difficult question, Jenny. I So Sir Isaac Newton said something that I'm very passionate about and I genuinely believe in. So if we're able to see farther, it's because we stood on the shoulders of giants. So we are able to do what we were able to do today because people before us did a lot of work. My job today is essentially to do as much as I can possibly can so that you and your generation can do even more. If you do not surpass us, then we have not done our jobs. That's the only way we're going to essentially advance the field. And if I can ultimately say, um, I got 100 students published, I got 100 students interested in academia to essentially break down that fear of publishing and writing a manuscript, I think my job would be like I would be very happy with that. I see myself as a mentor, um, and mentorship, unfortunately, is very hard to quantify. Um, it's what like as a researcher, I can look at my H index, right? It tells me how well cited my papers are, how prolific I've been, how many papers I've published. You look at a journal, you can see their impact factor. How well are they selecting papers that are getting cited in the future? There's no such thing that looks at mentorship and like a mentorship index. Uh, I joke with some colleagues about like maybe we need to come up with an M index just to look at that. But my goal, my legacy is essentially mentorship. If I can inspire people to conduct research and break down that fear of writing a manuscript, I would feel like my mission has been achieved. That would be my legacy.
Well, as one of the students that you are at the school you're very well known at, I think that you are well on your way to achieving that legacy. And I think that we're incredibly lucky as students to have many, many physicians like you who are passionate about academia and mentorship to help guide us in our future careers. Because I think you're absolutely right that we only get farther when we're standing on the shoulders of the ones who came before us. So we're very lucky to have you. And thank you for your time today for our Vitals of Academia podcast with Ben Gap. Anything else that you want to say before we wrap things up?
No, thank you very much for the opportunity. I genuinely enjoyed it. Jenny, it was great having you in the summer research program, and I encourage all of your colleagues and anyone listening, quite honestly, whether at NYMC or even outside NYMC, at this point we have our I don't know if you remember my Tuesday meetings. I still have those Tuesday meetings at 4 o'clock. That is like I'm religious about that. I also opened a an earlier meeting because I realized my poor international attendees who are like exhausted, but it's like 1 or 2 a.m. Like in India or in Tanzania or Saudi Arabia or like anywhere Latin America, and it's very late for them. So I started like a new meeting earlier in the day, also on Tuesday. And I have students from literally all over the country now joining like our research lab. Feel free to join. I would strongly encourage you to do so. And I think like ultimately, if nothing, you'll learn how to interpret the literature, and hopefully you'll be able to publish your own paper as a first author.
Yeah, that's super exciting, and thank you so much for getting that opportunity for all medical students everywhere. All right, thank you very much, Dr. Al-Mufti.
All right. Thank you so much, Jenny. Thanks for hosting.